Well, hello and welcome to all of our friends and viewers around the world. I'm Fiona Lang Sharp, IPCLC Director of Communications and MC here at Gold Learning. Welcome to our keynote presenter at Gold Neonatal Online Conference 2025. It is my pleasure to sit down with Dr. Jess Daigle, who is here with us today, and of course, her presentation coming up at our Gold Neonatal Conference. I'm so excited. Welcome, Jess. It's great to have you here today.
Thank you. Thank you so much for having me.
Yeah, this is such an exciting time and such a wonderful, presentation overall. And, we've had a chance to sit down and chat a little bit about kind of, this topic. And so I'll tell everybody what you're gonna be sharing about the power of language, how empathy transforms communication and care in the NICU. Now, this is a fascinating topic, and maybe we think, oh, it's easy to do, but that's not true. There's so much that happens, when we're on site with our families. And this is something that you've really discovered as well, right?
Yes, exactly. A lot of times we think because we've showed up and we do this every day, we're sharing the same types of information with families. We feel comfortable, but a lot of times we haven't really sat down to really think about the words we're using and the impact they may have.
Yeah, absolutely. So tell me, your story is fascinating, by the way. So I'm going to set you up in this question, but people are going to learn a little bit about you here, and your personal experience. So you've lived on both sides of the NICU experience, and as a physician and as a parent, which you're going to share, which I think is so important. How has this really shaped the way that you think about communication and empathy in this setting?
I think before I had my own son prematurely when I was a resident, going into my senior year as a pediatric resident. And prior to that, I was going into neonatal medicine because I love taking care of babies. Um, but at that time, as a young trainee, I was more focused on the medicine, the medical care that I was going to deliver, like really
Mhm.
being sharp and understanding the different diagnoses, the different diseases. And while in pediatrics, you're taught like the family is at the center, it's very hard to really like I think about until you're really forced to into that type of mindset. I believe I think it's one thing to say it, but it's another thing to practice it in the care that you deliver. And so after having my own son in the NICU and really being on the other side in terms of the psychosocial and emotional challenges and even my own personal struggles with going back to training and trying to navigate caring for a preemie at home, it made me think about what my families are really enduring when I'm speaking to them at the bedside and I'm witnessing behaviors or attitudes or the way that they even communicate. It made me think about them differently, see them differently, and say, what's behind this behavior, this attitude, this thought, this language that they're even using or lack of using, right? As we'll get
Right.
into my talk, communication is nonverbal and verbal. And so it just made me more aware in a different way. Like I knew in my subconscious, like, yes, parents matter. My friends would tease me, oh, I can't do pediatrics because you got to deal with the parents. And I used
Right.
to laugh at that. But now I realize, like, the parents are human too, just like us, and they're afraid and they're scared and they need us to communicate that we understand that and that we see them. And so that's how my experience has shaped me doing that
Mm.
more because I've been on that side of wanting someone to realize that about me.
I love that. And you're the epitome of change, I feel, really in the NICU. And in fact, I'm gonna plug you right now and say, like, you need to go and follow Jess over on LinkedIn, because I love your posts and you really keep people up to date, and you show kind of the different depth of, what we can do, how we can put these things into action right away. And I think that's what your presentation really reminds me of, is that people are going to come, they're going to learn, but they're also going to find out how to put things into place right away. Like the things that we're talking about today, which is so invaluable. And I'll mention again that the presentation you're doing for us over on Gold Neonatal is free and open access, so anybody can come, right? We've been talking
Anybody.
about this a lot, and how wonderful it is when we can do that for our bigger communities. So
I
that's
love
just
that.
awesome. Yeah.
Yeah, this topic is transformative for any setting in healthcare, and it could even be used outside of healthcare. Any interaction. any interaction that you're having with other people, language and
Mhm.
communication matters.
Yeah, absolutely. All right, let's think of a time that really, shifted you or, changed your thought process too, in terms of language with working with families. So can you share just a little example of a time when that you had that shift or you noticed a difference and, that they really responded with being supported?
I'm so sorry, Fiona. I thought that my husband, he's calling me. I don't know if y'all will be able to pause this or clip it together, but he keeps calling. And I'm
Yeah,
trying to
we
tell
can
him
we can
that
pause it right there. You want to go ahead? Well, that's wonderful, Jess. And I want to shift now into something that is again, we're talking about these examples and being practical and such. But you yourself, I mean, and this is where your sort of life work has changed now when you're working with families. So can you maybe give us an example of a time when you were, working with a family and you saw that sort of that simple shift that made a big difference for a family where they felt supported?
yes, so I actually wrote a good blog about this as well. But one encounter I have specifically in the unit was I was working with an Indian family on breastfeeding. The mom was trying to latch the NICU baby, and the dad was there, and he was, like standing over. In my mind, he was probably trying to assist, trying to see how he could help. But the nurses who were sitting over there on the side were a little bit frustrated. And later on, they told me like, "Oh, the dad, he's like in the way. He's trying to control things." And I was like, well, I think we should get curious and just ask them what is typical in their culture when it comes to breastfeeding. Like, but what does he see his role as when his wife is trying to latch the baby? What is it that he's hoping to do or trying to help to do? And so then when the next encounter came, that's exactly what I did. I just kind of asked him, hey, I introduced myself. Who am I? This is what our goals are for the baby. And asked them, so what is your role, like in Indian culture? How does breastfeeding look to you? What do dads typically do? We just had a really good conversation.
Yeah.
And he actually ended up cooking me some homemade Indian food
Oh,
and bringing it in the next day.
yeah.
And what it really did was show like it's so important for us to be curious and just being willing to shift that narrative of asking a
Mm,
question. And again, those labels, like if we're deeming someone as being controlling or perceiving them as difficult, or a lot of these words and labels we love to put on families in medicine, a lot of times we're really bad about this, especially in the NICU. Non-compliant. We throw lots of terms out there, but that shapes the way that we interact with that family, right? If you perceive them as that, then you're going to act differently towards them, which is then going to make more tension, as opposed to saying, well, even if that is what you perceive, like, well, get curious, well, why is he doing that? Or
yeah.
what does he think his responsibility is, right? It's just like anything else. If I think I'm supposed to show up a different way and they think I'm supposed to show up a different way, there's that disconnect. Again, that communication is failing there. Then we need to find a way to bridge that gap of communication. And that's through curiosity and just being open minded to ask questions. So I have lots of examples of that. And I see it all the time, just in small ways, by
Right.
being able to say, well, let me ask. I have another example where a mom didn't have her band or something. I think one of the times the nurses had forgotten to reband her or something happened with the bands. But anyway, the mom came in. We had been seeing her like, so she had been visiting already 3 days, but it was a new nurse that was on, and she was a real stickler. And she was like, "Hey, you cannot come in here.
Right.
What with men and things like that." And we were like, "No, we know that this is mom. We've been seeing her like every day, and like."
Yeah.
I agree, she does need to get it handled, but the energy we bring, like, okay, hey, Miss Johnson, hey, you misplaced your band, or what happened with your band? Okay, well, we need to get you rebanded. It's for the safety of your
Right.
baby and us.
Sure.
Instead of like coming at her like it's her fault. That was a big assumption because it really wasn't her fault. Like someone else had failed in the chain line, like to give her what she needed. And I probably even shouldn't say that word failed, but she just didn't get the one that she needed, right? It was a
Right.
process. It was like an internal processing problem, not the mom didn't do what she was supposed to do. But just that shift in witnessing that and treating her differently allowed her to keep showing up, versus the language of you didn't do something you're supposed to do that causes families to shut down, and then that widens that gap of trust that we need to establish in the NICU. So every day, every word, language, like behavior cue, facial expression, hand gesture, all these things.
Right.
We're communicating all the time.
Yeah.
And if we don't realize that, then we miss opportunities to connect with our families.
Yeah. No, I love that. And that's what this is all about. This presentation is just, about what we can do to change, because this then, I think, we're always looking for ways not only to, support families, because it's the big heart that we all come in with, to support families. But if we're not checking ourselves, or we don't know the impact that it's having.
Yeah.
So this presentation really is the power of language. I mean, that's the title, the power of language and how empathy transforms communication and care in the NICU. I'm so looking forward to this presentation, honestly, because I know that you've got examples, vignettes, and so much interaction with the audience as well. So I'm hoping that they will all bring it on the day,
That's
and
right. Bring
we're
that
gonna,
energy, and
yeah.
then they can take away real time and say, you know what, today I'm gonna be mindful of this and do
Yeah.
this.
And then see the results. That's what we're looking
Yeah,
for, right? Watch those results.
that's
Thank you
right.
so much, Dr. Jess Daigle. It's lovely to have you here today. And of course, you can all join us on goldneonatal.com for Dr. Jess's presentation, open access and free to all of you. It will be recorded, and you actually will be presenting it twice so we can get all of those time zones in as well, which is fantastic. Thank you again for joining me here today, Jess, and we'll look forward to
Thank
seeing
you.
everybody all very soon. Bye bye for
Yes,
now, everyone.
excited. Bye.